Knee replacement surgery, and it's a surgery that I perform for patients who suffers from, for example, osteoarthritis, when the articular surfaces are worn out and they struggle with pain because the cartilage is worn out and the bone can hit the bone, and this causes pain and disability. And knee surgery, knee replacement surgery, designed to remove these worn out surfaces and replace them with metal and replace the structures in between with a plastic. So it's a metal and a plastic implant within the knee designed to replace the worn out surfaces. It is designed to relieve pain and improve function for those who are affected by osteoarthritis or other conditions that affect the articular cartilage, like rheumatoid arthritis or in general inflammatory arthritis, but also patients with old trauma that affect their articular surface, and they can develop secondary osteoarthritis related to that. But sometimes we also do this operation for instability associated with some wear and tear in the joint. These are the most common causes for that require knee replacement. Knee replacement itself can be partial or full knee replacement. So knee replacement can be conventional knee replacement or robotic assisted operation. I do most of my knee replacements robotically assisted. And this is one way of doing it. As I mentioned before, this can be partial or full knee replacement. And I mean by partial knee replacement, if only one part of the joint is affected. For example, the inner compartment of the joint has a worn out cartilage, then we replace only that part of the joint rather than the whole joint. However, if two or more compartments are involved, then probably a total knee replacement where we replace the inner, the outer compartment, as well as the compartment behind the kneecap. What patient expects after this and the recovery as well after this procedure is to have pain relief and improve function, because the majority of these patients who undergo these operations, they suffer from pain and disability related to, for example, instability within the joint. So it will be painful after the operation, as any other operation, but specifically knee replacement is a painful surgery, especially in the first few weeks. But this eventually will settle, and this can be managed with pain relief and painkillers to help the pain. And patient expect to recover within 6 weeks to 3 months. During that time, we require elevation, ice packing, and needs to move and walk with and without the help of crutches, that need robust physiotherapy treatment and a protocol to prevent stiffness and to allow the patient to walk more and more to achieve good level of function after the operation. After knee replacement surgery, there is no much needs to be adapted. All what the patient needs is to start to walk immediately after the operation, because this will improve function and recovery. Things that needs to be adjusted, for example, the use of the crutches. At the beginning, the patient will require crutches, and therefore they need to know how to use the crutches and to walk with the crutches. For example, at the beginning, getting up and down the stairs can be a little bit painful, but we make sure before any patient leave the hospital that they do the stairs and make sure they are safe with the stairs. Having said that, some people struggle in the first few days, up to a few weeks with the stairs, and sometimes we recommend having a bed or a toilet downstairs rather than upstairs. But majority of my patients, they walk and they do the stairs without any issue. But this is one of the things I mentioned to make sure they are aware of that. Things that needs to be probably hired or to be available after the operation is ice machine or any other cooling machine that helps to reduce the swelling after the operation. And there are many available in the market, but the simplest way of doing that, having a small bag of ice or even frozen peas that can be put on the knee when the patient is relaxed and sitting on a chair with the leg elevated. Apart from that, they can go back as soon as possible to whatever they want. One of the things that some of the patients mention is kneeling. Kneeling can be slightly difficult after knee replacement, especially in the early stages. But if they need to have it done and they need to do it, sometimes we advise for wearing pads. But kneeling can be slightly painful, especially in the first few weeks, that therefore we advise try to avoid kneeling. Apart from that, I don't think there is any other adaptation or anything needs to be changed after the operation.